navigating healthcare, it can often feel, well, less like a clear path and more like wading through a thick forest, right?
Uh-huh. It really can.
Especially when you're trying to figure out not just, where to get the best care, but also how to actually pay for it.
Yeah, without getting totally lost in the paperwork or hit with surprise costs.
Exactly. There's just so much information flying around.
It's definitely a complex system. And look, during times of illness or injury, when you're already feeling vulnerable, having that clarity and confidence, both in the quality of the care you're getting and how you'll handle the financial side, it's just paramount.
Absolutely. So for this deep dive, we've gathered a collection of material research, guides, even some sort of behind-the-scenes perspectives that really drill into two vital areas. First, the big efforts to make sure healthcare organizations actually meet high standards for quality, for patient safety.
Right, the frameworks.
And second, the really practical, need-to-know stuff about health insurance. Particularly relevant, based on some of our sources, for navigating the system in places like India.
Our goal here is basically to cut through some of that noise. We want to unpack what these quality standards, like accreditation, really mean for the care you experience.
And just as critically.
And crucially, arm you with the essential knowledge about your health insurance so you can navigate the system, access the care you need without all that confusion or, those awful, unexpected financial hits.
Think of this as getting the key insights, the shortcuts maybe, without having to wade through all the dense material yourself. Let's jump in.
Okay, so let's unpack this first bit. How does the system itself try to build in quality and safety? It really starts with organizations whose whole job is setting and enforcing standards.
And when you look globally, the big name that just keeps coming up is Joint Commission International, or JCI. They're really widely recognized as a sort of leader in pushing for higher healthcare quality and patient safety worldwide.
Yeah, JCI has been working on this, on quality improvement globally, for well over 2 decades now. Their mission, it's pretty simple but powerful. Enable and affirm the highest standards of care and safety for everyone.
And they really are everywhere. I mean, the sources show them working across more than 70 countries.
Wow.
They've accredited or certified over 1,000 programs, and they have something like 600 experts around the world helping out.
And their core approach is developing these really rigorous international standards. A very concrete example of their work is the focus on international patient safety goals.
Okay, what are those exactly?
Well, these aren't just vague ideas. They target common critical problems, things like preventing surgical errors, reducing the risk of infections you might get in the hospital.
Right, things you really worry about.
Exactly. And organizations that get accredited have to actively work towards these specific, measurable goals.
And it's not just accreditation, right? JCI offers other things too.
Yeah, they have a whole suite of resources, certifications for specific types of care, like telehealth, which is huge now.
Sure is.
Advisory services, training programs. They provide a whole system, really, to help hospitals get better.
Okay, so what's the JCI advantage they talk about?
Well, it comes from that deep, long-standing expertise. They're laser-focused on achieving what they call highly reliable care delivery.
Highly reliable, okay.
Their vision is aiming for zero harm. And they offer tools and resources for everyone in the organization, from the top leadership right down to the nurses and doctors on the front lines.
And this is where it connects directly back to you, the patient. When a hospital or clinic seeks JCI accreditation, they're undertaking this massive effort specifically to deliver that reliable care and reduce potential harm.
Right. It's not just a badge.
No. And some examples from the sources really show the impact. Alex Land from Hong Kong Adventist Hospitals called JCI accreditation one of the best team-building exercises they've done. Said it hugely improved how staff work together, communicated.
That's interesting. Better teamwork usually means safer care.
Exactly. And Shiji Kurian at Burj-Al Farha Hospital mentioned that while, yes, it gives them a competitive edge, the real value is that it strengthens community confidence. It means the hospital has better systems for managing risks, and they're actively trying to build this culture where patient safety is just number one.
Those are real benefits, tangible things aimed at protecting you and improving your experience when you need care.
Okay, so that's the global picture with JCI. Now, let's zoom in a bit, particularly to India, where another key player comes up. The National Accreditation Board for Hospitals and Healthcare Providers, NABH.
Right, NABH. It's actually a constituent board of the Quality Council of India, and it was set up specifically to establish and run accreditation programs tailored for healthcare organizations within India.
So it's designed to meet the needs of consumers there and set relevant quality benchmarks for the Indian health industry specifically.
Exactly. And while it gets support from different groups, the industry, consumers, the government, it operates with full functional autonomy.
And why is that autonomy important?
Well, it means its standards aren't just dictated by, say, the hospitals themselves or any single interest group. They can focus purely on quality, independent of those pressures, makes the standards more credible.
Got it. And their goal?
NABH explicitly aims to build an ecosystem for quality across Indian healthcare. So, much like JCI does globally, achieving NABH accreditation in India signals that a hospital has voluntarily signed up to meet these pretty demanding quality and safety standards.
Which, again, loops right back to you. If you choose an NABH-accredited hospital, generally you're choosing one that's been through a really tough evaluation, designed to improve the quality and safety of the services you'll actually receive.
So you've got JCI setting a global bar and NABH doing something very similar, tailored for India. Both are crucial forces pushing healthcare providers towards better standards.
Okay, this is where I find it gets really interesting. We talk about these standards, JCI, NABH. But how do hospitals actually do it? Achieving accreditation sounds like a huge amount of work. How do they get from, their starting point to meeting all these incredibly detailed requirements?
It is a monumental task, you're right, and this is where often specialized expertise comes into play. One of our sources highlighted a company called Supreme Medic Consultancy as an example of this.
Okay, so what do companies like that do?
They essentially act as guides. They support hospital owners through that entire really complex journey.
What, for the beginning?
Yeah, from the initial idea planning and designing the hospital all the way through to actually getting and maintaining that accreditation, like NABH.
And they work with different sizes of hospitals?
All sorts. Small clinics, medium-sized hospitals, large multi-specialty centers, even diagnostic labs. They help set up the physical infrastructure, sure, but also, critically, they assist with the day-to-day operational stuff, the nitty-gritty.
Like what kind of operational stuff?
Well, their services include things like the planning and design, obviously, but also direct NABH accreditation support, helping recruit the right doctors and nurses, figuring out manpower planning, how many staff you need where, and operations management.
And under operations management, I saw they mentioned preparing SOPs, standard operating procedures.
Exactly. Think of SOPs as the detailed, step-by-step instructions for basically every single process in the hospital, from how you admit a patient, to how equipment is sterilized, to how medications are managed.
Wow. That sounds incredibly detailed.
It has to be. Accreditation standards demand strict adherence to documented procedures. That's how you ensure consistency, reduce errors, improve safety.
Makes sense.
They also help with things like analyzing hospital capacity, making sure beds and operating rooms are used efficiently, and even restructuring departments to improve workflow and meet safety guidelines.
And they get involved in physical stuff too, right? It's specialized equipment.
Yeah, they mentioned offering products like modular OTs. Those are like prefabricated operating theaters. They offer really high levels of cleanliness and precise environmental control, often needed for complex surgeries and meeting tough infection control standards. And installing things like medical gas pipelines, ensuring safe, reliable delivery of oxygen, nitrous oxide, medical air, which is absolutely fundamental to patient care and safety.
Right. Seeing that level of detail, the planning, the recruitment, writing all those SOPs, the specialized installations, it really highlights just how much effort, specific expertise, and, frankly, investment goes on behind the scenes.
Absolutely.
It's clearly not just about hiring good doctors. It's about building an entire system that operates reliably and safely to meet those rigorous standards like NABH.
Exactly right. So that gives us a clearer picture of the immense efforts healthcare organizations undertake, often needing expert help just to build that quality and safety into their very foundation. But all that high-quality care still needs to be accessed, right? And the costs need to be managed.
Which brings us to the other side of the coin.
Precisely. This is where understanding your health insurance becomes absolutely critical for you, the patient.
And it's a point that really came through in our sources, including outlines for resources like something called the Lifelines by Supreme Medic podcast and guides like Your Health Insurance Compass. They really hammer home that knowing your insurance isn't just nice to have.
No, it's essential because, as one source pointed out, particularly in the context of India, Far too many families only really start trying to understand their health insurance policy when they're right in the middle of a medical emergency.
Which is absolutely the worst time, isn't it? Trying to figure out waiting periods or co-pays when you're stressed and worried.
Exactly. Understanding your policy before you desperately need it can prevent huge amounts of confusion, potentially even life-threatening delays in getting care started, and certainly those financially crushing unexpected bills.
Okay, so let's try and unpack some of the practical knowledge these guides highlight. Where do you even start?
Well, first, just understanding the basic types of policies you might have, especially common ones mentioned for India.
Okay, like what?
Like an individual policy, pretty straightforward, just covers the person who bought it.
Right.
Or a family floater policy. This covers multiple family members, say you, your spouse, your kids, under one single shared amount of coverage, the sum insured.
So everyone draws from the same pool of money.
Exactly. And then there are critical illness policies. These are different. They typically pay out a lump sum of cash if you're diagnosed with a specific, very serious illness listed in the policy, like cancer or stroke. It's separate from your regular hospitalization policy.
Got it. So knowing which type you have is step one, tells you who's covered and how the money works.
Precisely. Then come the key terms. These are like the building blocks of your policy. You have to get the hang of these.
Okay, let's break them down.
First, the sum insured. That's the absolute maximum amount your insurance company will pay out for covered treatments within a policy year.
Okay, the total limit.
Then the premium. That's the regular payment, maybe monthly, maybe annually, that you make to keep the insurance policy active. If you stop paying the premium, you lose coverage.
Right. Then there's the deductible. This one trips people up sometimes.
It does. The deductible is a fixed amount of money you have to pay out of your own pocket for covered healthcare services before your insurance company starts paying anything at all.
So if your deductible is, say, 10,000 Cree, you pay the first 10 grand of covered costs yourself.
Correct. After that, the insurance kicks in, usually with copays or coinsurance.
Okay, so what's the difference between copay and coinsurance?
Good question. A copay or copayment is usually a fixed fee you pay for a specific service, like maybe $500 for a specialist visit or $100 for a generic prescription after you've met your deductible, if there is one.
Okay, a set amount.
Whereas coinsurance is always a percentage of the cost. It's your share of the cost after you've met your deductible. So if your plan has 20% coinsurance,
you pay 20% of the bill, the insurer pays 80%.
Exactly, up to the policy limits, of course.
And then there's the out-of-pocket maximum. That sounds important.
It's your financial safety net, really. It's the absolute most you will have to pay for covered medical expenses in a policy year through your deductibles, copays, and coinsurance combined.
So once you hit that maximum spending level,
your insurance should typically pay 100% of covered costs for the rest of that policy year. It protects you from catastrophic costs in a bad year.
Okay, that's clear. What about waiting periods?
Very important. These are specific lengths of time after you first buy a policy during which certain illnesses or treatments are simply not covered.
Like right at the start?
Yeah, there's often an initial waiting period, maybe 30 days, where nothing except maybe accidental injuries is covered. And then there can be longer waiting periods, maybe 1 or 2 years, for specific conditions like cataracts, hernias, joint replacements.
So you can't just buy insurance today and have surgery for your knee next week if it was already bothering you?
Generally, no, which leads directly to pre-existing conditions.
Right. The illnesses you already had before you bought the policy.
Exactly. Policies nearly always have specific longer waiting periods, often 2, 3, even 4 years, before they will cover treatment related to those pre-existing conditions.
And it's crucial to declare those up front when you apply, isn't it?
Absolutely critical. Hiding them can lead to your whole policy being canceled or claims being denied later, be honest.
Okay. What about the cashless network? That sounds convenient.
It is hugely convenient. These are the hospitals and clinics that have a direct billing agreement, a tie-up with your insurance company.
So if you go there.
If you go to a network hospital for a covered treatment and you get pre-authorization, you typically don't have to pay the main hospital bill up front. The hospital settles the covered amount directly with the insurer. You'd only pay for your deductible, copays, or things that aren't covered by the policy.
Much easier than paying a huge bill and waiting for reimbursement.
Definitely. Going to a non-network hospital means you pay the entire bill up front yourself. Then you have to gather all the paperwork and file a claim to get reimbursed later.
Got it. And one more term, formulary.
Right. If your plan includes coverage for prescription drugs, The formulary is the specific list of medications that your insurance plan covers. Often drugs are grouped into tiers with different copays for generics versus brand names versus specialty drugs.
So you need to check if your specific medication is on the list and what it will cost you.
Exactly. And the sources also mention becoming familiar with documents like the SBC.
Summary of benefits and coverage.
Right. That's a standardized, easy-to-read summary of your plan's key features, what it covers, what you pay, and the EOB.
Explanation of benefits.
Yeah, you get this after you receive care and a claim is processed. It shows what the doctor or hospital billed, what the insurance paid, what they didn't pay, and why.
These aren't just junk mail then.
Yeah.
They're your tools to check everything was handled correctly.
Absolutely, you need to read them.
Okay, so we know the terms. What is typically covered by health insurance based on these guides?
Generally speaking, the core coverage is for hospitalization costs. Specifically, inpatient treatment where you're admitted to the hospital for more than 24 hours.
Okay, so that would include?
That includes the room charges, up to your policy limit, nursing care, surgery and procedure charges, fees for the surgeon, anesthesiologist, other specialists while you are admitted.
What about tests and medicines during the stay?
Yes. Medicines, drugs, consumables directly related to the treatment, and diagnostic tests like blood work or x-rays during your hospital stay are usually covered.
And I think you mentioned pre- and post-hospitalization.
Right. Many policies cover medical expenses incurred for a certain period before you were admitted, say 30 days, if related to the reason for admission, and also for a period after discharge, like 60 or 90 days, for follow-up care, medicines, tests related to that same condition.
That's good to know. What about preventive stuff?
Preventive care is increasingly covered, sometimes even fully, without you paying anything. Things like certain vaccinations, cancer screenings, maybe an annual health checkup depending on the plan.
Emergency care.
Emergency care is always covered, legally, but how it's covered might depend on whether the hospital is in-network or out-of-network. You might have higher costs out-of-network even in an emergency once you're stabilized.
Prescriptions.
Often included, yes, but again, check your specific plan and that formulary list we talked about.
Specialist visits, like seeing a cardiologist.
Usually covered, yes, but how you access them can differ. Some plans, like HMOs, health maintenance organizations, might require you to get a referral from your main doctor first. Others, like PPOs, preferred provider organizations, might let you see a specialist directly, but it might cost you more if that specialist isn't in their preferred network.
And things like mental health care, maternity care.
Also commonly covered now, often mandated by law in many places. But you absolutely need to check your specific policy for limits, waiting periods for maternity, or specific requirements for mental health therapy sessions.
Okay, so that's a lot of potential coverage, but just as important, maybe even more so sometimes, is knowing what is likely not covered. Yes, this is the exclusion list in your policy document. You really, really have to read this section carefully.
So what are some common exclusions we should be aware of?
Well, a big one is often OPD outpatient department visits. Just going to see your doctor for a consultation, a checkup, or a minor issue without being admitted to the hospital. Usually not covered by standard health insurance.
Okay, so routine doctor visits are out.
Generally, yes. Same for routine blood tests or annual health checkups, unless your policy specifically includes a wellness benefit or package that covers them. Don't just assume.
What about surgeries that aren't strictly necessary?
Right, cosmetic or purely elective procedures are almost always excluded. Things like plastic surgery for aesthetic reasons, LASIK eye surgery just to get rid of glasses unless there's medical need, hair transplants, that's usually on you.
Dental care, vision care, like glasses or contacts.
Typically excluded from standard health insurance. You usually need separate specific dental or vision insurance policies for those.
Okay. And consumables. You mentioned those earlier.
Yeah, things like gloves, syringes, cotton swabs, bandages, even PPE kits used during your hospital stay. Traditionally, these were often not covered and could add up on your final bill.
But that might be changing.
Some newer, more comprehensive policies are apparently starting to include coverage for consumables, but you absolutely must check your specific policy wording on this. Don't assume.
What else? Room upgrades.
Definitely. If your policy covers, say, a standard private room, but you choose a deluxe suite, you will pay the difference in cost per day out of your own pocket. The upgrade cost is almost always excluded.
And we mentioned waiting periods.
Right. Treatment for any pre-existing condition is specifically excluded until that condition's waiting period, maybe 2 to 4 years, is fully completed.
And choosing hospitals outside the network.
If you have certain types of plans, like an HMO, going to an out-of-network provider for non-emergency care might mean the service isn't covered at all. Even with a PPO plan that allows out-of-network care, you'll face significantly higher deductibles, co-pays, or co-insurance. They cost you more.
Wow. Okay, so those details, the exclusions, the network rules, they really matter.
They make a huge difference to your out-of-pocket costs.
Yeah.
So, knowing all this, how do you actually use your health insurance smartly? The guys offered some really practical do's.
Okay, what's number one?
Always have your insurance card, the physical one, or a digital e-card saved on your phone readily available. Hospitals need that information right at the start, especially if you want cashless service.
Makes sense. What else?
If it's not an absolute emergency and you have a choice, try to use a hospital that's in your insurer's cashless network.
Right. Check the list beforehand.
Exactly. Check your insurer's website or app before you need care so you know where you can go for potentially smoother processing and less upfront payment.
And communication with the insurer is key.
That's crucial. You need to inform your insurer or their TPA, that's the third-party administrator, the company that often handles the claims processing for the insurer, as early as you possibly can. Typically, for a planned hospitalization like a scheduled surgery, you need to inform them maybe 24 to 48 hours in advance to get pre-authorization.
Authorization.
Okay. For an emergency admission, you usually need to inform them within 24 hours after you've been admitted. Skipping this notification or pre-authorization step is a major reason claims get delayed or even denied.
Got it. What about costs?
Ask the hospital for a detailed cost estimate before the treatment begins, especially if it's a major surgery or you anticipate an ICU stay.
Why? Just to prepare.
Partly to prepare, but also to understand what the hospital thinks the bill will be, so you can have a more informed discussion with the insurance desk about what's likely covered and what might be your responsibility. Ask for it in writing if possible.
And don't be afraid to ask lots of questions, I assume.
Absolutely. Before any significant procedure or admission, ask specific things like, is this hospital definitely in network for my specific policy plan? What is my daily room rent limit according to my policy? Will all the medicines and tests the doctor plans to order be covered? Does my policy cover follow-up care after I'm discharged? Is pre-authorization required for this particular surgery or treatment?
Get clarity up front.
Yes. And take the time, ideally before you get sick, to really clarify all those policy details we discussed earlier. Know your waiting periods, understand the pre-existing condition clause, check for any sublimits, like caps on specific treatments like knee replacement or room types. Know your co-payments and deductibles and understand exactly how the pre-authorization process works for your insurer.
And keep records.
Meticulously. Keep copies of absolutely everything.
And
your policy document, any forms you submit, any approval letters from the insurer, all the itemized hospital bills, payment receipts, the discharge summary, all test reports, and any emails or letters exchanged with the insurer or TPA.
why keep everything?
Because if there's a dispute later or you need to follow up on a claim, having that documentation is your proof. Also, verify every statement you get, like that EOB, to make sure the claim was processed correctly and you weren't overcharged.
And understand the claims process itself.
Yes. Know what documents your insurer specifically requires for a claim. How long does reimbursement usually take if you paid up front? Who is the specific person or department you should contact if there's a problem or delay? Knowing this saves enormous frustration later.
Okay, that's super helpful for using the cashless facility. What if you do end up at a non-network hospital and have to claim reimbursement?
Right, that's a different process. First, you have to pay the entire hospital bill up front yourself. No way around that usually.
Okay, then what?
Then, you need to collect all the original documents. That means the itemized bill showing every single charge, the official discharge summary from the hospital, all your investigation and test reports, original pharmacy bills, if applicable, doctor's prescriptions, everything.
Get everything. Originals.
Yes. Then you fill out your insurer's claim reimbursement form accurately, attach all those original documents, make copies for your records, and submit the whole package to the insurer or TPA.
And then you wait.
Pretty much.
Yeah.
And follow up regularly. Processing a reimbursement claim can take anywhere from 2 to 4 weeks, sometimes even longer, depending on the complexity and the insurer. Persistence helps.
That sounds like more hassle. Definitely reinforces trying to use a network hospital if possible.
For sure. The guides also mention something important, particularly for India. Being aware of government health schemes.
Ah, yes, like Ayushman Bharat.
Exactly. Ayushman Bharat, also known as PMJAY, is a huge scheme providing health coverage up to 5 lakh per family per year for secondary and tertiary care hospitalizations aimed at vulnerable, low-income families.
That's a critical safety net.
Absolutely. And there are other schemes too, like CGHS for central government employees, ESIC for workers in the organized sector, plus various state-specific health insurance schemes that offer free or heavily subsidized care, often in government or selected private hospitals.
So it's worth checking if you or your family might be eligible for one of these government schemes as well.
Definitely. And finally, the guides highlighted some common mistakes to actively avoid.
Okay, what shouldn't we do?
Don't just file your policy away and ignore it until you're literally in an ambulance. Read it before you need it.
Makes sense.
Don't ignore sublimits. Don't just look at the big sum insured number and assume it covers 100% of everything up to that amount. There might be caps on specific procedures or room rent.
Right, the fine print matters.
Don't wait until you're being admitted to the hospital to confirm coverage details or start the pre-authorization process. Do it beforehand as possible.
Be proactive.
Don't skip getting the necessary signatures or complete documentation when filing a claim. Missing paperwork is a primary reason for delays. And don't just assume every treatment at a network hospital will be cashless. Always confirm pre-authorization and coverage specifics first.
Those are really practical pitfalls to watch out for.
Yeah, and these tips, understanding the terms, knowing the typical coverage, they really seem to come straight from the practical insights and sources like that Lifelines outline. And the insurance guides, they make it clear that becoming informed really is your best strategy here.
So when we pull all of this together, what's the big picture? We've taken this deep dive into, on one hand, the world where healthcare organizations are actively pushed towards higher quality and safety through accreditation standards like JCI and NABH.
A really complex process.
A complex process, yeah, often needing help from specialized consultants like that Supreme Medic example to get the systems right.
And then, on the other hand, we've unpacked the critical details of health insurance. From understanding your specific policy type and those key terms,
deductibles, copays, networks,
to knowing what's typically covered and, just as importantly, what's excluded. And we've covered those essential practical steps for actually using your policy effectively to access care.
And the core takeaway here seems to be that health insurance is really more than just, a piece of paper or a card in your wallet. As one source put it, it's a tool for building confidence when you need care.
Confidence during care. I like that.
Yeah. Being armed with the knowledge about your specific policy details what's covered, what's not, how to get pre-authorization, how the claims process works. It can dramatically reduce your stress levels. It allows you to access care from those potentially high-quality accredited providers without being completely blindsided by the financial side of things.
This whole picture, it raises an interesting question, doesn't it? If you have healthcare organizations genuinely working towards greater transparency, quality, and safety through things like accreditation.
The push from the provider side.
And then you, the patient, are simultaneously empowering yourself with the knowledge to understand and navigate the financial tools, like your insurance.
The pull from the patient side, becoming informed.
Right. How does this combined effort, this push and pull from both sides, potentially create a more reliable, more predictable, and ultimately maybe more trustworthy healthcare experience for everyone involved in the whole system?
That is a great question, something definitely worth considering as you navigate your own healthcare journey, hopefully now with a bit more understanding of what's happening behind the scenes and how you can take control of your part in it.